test for your cervical rotation first. So if I could see you look this way, please, and this way. Good. It looks like you're a little bit more limited looking to your right. So if I could have you lie on your back here. And so what we're going to do is I'm just going to cradle your head here. We're going to maximally flex. All right, everything okay?
Yep.
And then we're going to rotate to the left, being sure to maintain the axis and not allow any lateral bending to happen. And it does look like you're a little bit more limited rotating to your right, so I'm going to ask you to try and straighten your head out and look forward again. So turn your head to the left. Good, good, good. And we're going to hold that for 7 seconds. Go ahead and relax. Good. And try it again. Go ahead and turn. Good, good, good. And relax. We're going to do that 3 to 5 times. All right. Go ahead and sit up and we'll reassess. All right, and if our patient has cervical pain, we can assess the cervical vertebrae by doing some PA mobilizations, just feeling for any hypomobile segments. So what I'm going to do is take my fingers and take up the slack here on the sides, and then with my thumbs together, I'm going to place them over the spinous processes and feel for a hypomobile cervical vertebrae. Good. Good. And then once we found a hypomobile segment, I'm gonna, again, just taking up the slack with my fingers here and my thumbs together over the spinous process. I'm gonna apply some gentle oscillatory forces, just for about 6 to 8 seconds. And is everything all right?
Yep.
I'm just checking for reactivity and then continuing. Everything okay?
Yes.
And once again, and I'm moving the full vertebrae, not just pushing on the spinous process. Good. And then we'll reassess their pain and their symptoms from there. All right, so once we've determined that our patient is limited in her thoracic extension, we're going to do a mobilization that will hopefully facilitate her thoracic extension or at least decrease some of her pain. Once we've located the segment that we want to mobilize, we're going to take our left pisiform and place it on the transverse process of that vertebrae. And then we're going to take our right pisiform and place it on the other transverse process. And we're going to just take up the slack by rotating a little bit. And then we're going to impart a high velocity but low amplitude thrust to this segment. Ready? Good. All right, is that okay?
Yep.
All right, so from here we would reassess the patient to see if her thoracic extension has improved or her pain has decreased. So we've determined that our patient has some issues with rotation in her lumbar spine, so we need to facilitate gapping on the right side of her facet joints. So what we're going to do is feel for the spinous process of the lumbar vertebrae that is hypomobile. So we're just getting a feel between the spinous processes, which one might be hypomobile. And then once I've located the segment I want to work on, I'm going to have her lock her foot behind her knee and her leg off the table while I block it with my thigh. I'm going to keep my hand on the segment that I want to work on while I have the patient rotate slightly. Good, just like that, good. And then you can grab that arm with the other hand. Good, I'm going to slide my arm under here. My forearm is going to go in her deltopectoral groove. My other forearm is over her sacrum. And I'm going to have the patient do a quarter turn roll just to make sure we're at end range and take up all the slack. And then once we're at end range, we're going to impart a high velocity, low amplitude thrust. All right, and then we would reassess the patient and see if their pain has decreased or if there's a little bit of increased rotation of the lumbar spine. All right, so for this patient, after doing a supine to sit test, we've determined that her right innominate is posteriorly rotated. So we're going to do a muscle energy technique to hopefully correct that rotation. So what we're going to do is have the patient's right side, her involved leg is going to be the one extended and on the plank. And then we're going to have her left leg flexed and her knee flexed. And what I'm going to ask the patient to do is try your hardest to kind of straighten that leg out and put it back on the table while you're trying your hardest to lift this leg off the table. I'm going to prevent you from doing both those actions. We're going to hold that for 5 to 6 seconds, and we're going to do that for 3 times. All right, so we're going to stabilize the left leg, stabilizing the right leg. Again, we're going into extension, and we're going into hip flexion on this right side. So on the count of 3, 1, 2, 3, go ahead and contract. Good, good, good. Hold and relax. Good, everything all right?
Yep.
All right, we're gonna do that again. Go ahead and contract. Good, good, good. And relax. Good, everything okay? All right, and one last time. Go ahead and contract. Push, push, push. Good. All right, and relax. And then we're gonna reassess her symptoms and her pelvic mobility from here.